Anti-wrinkle injections. Think of it this way. It's a dark night, you're coming home, you've got your bunch of keys in your hand, and you go to put the key in the lock, and it fits the lock, but it doesn't turn. So that's a little bit like the substance in anti-wrinkle injections. It actually blocks the key holder, the lock, so that you can't actually open the lock. That means that the muscle doesn't move, or at least it reduces its activity. So sometime in that next 4 months, the receptor, or the lock if you like, gets replaced by the body and a new lock gets put in so that the real key can come in and turn the lock and move the muscle. That's basically how anti-wrinkle injections work. A lot of people have a sort of fear of needles, and I'm certainly one of those people. The things that you'd probably be a bit concerned about would be the actual discomfort itself. What would it look like when you walk out of the clinic? How long it would take to work? Are there any side effects like bruising and these sorts of things? And are there any complications? Well, anti-wrinkle injections are relatively safe, but there's all sorts of little traps that people don't really know about, which I'd like to talk about. So the first thing is, when I get anti-wrinkle injection substance, it comes in a little thing like this. So there's 100 units in here, and it comes as a dry powder. So what you're supposed to do is you're supposed to dilute this with what they call sterile saline, 2.5 mils. You might see these places where they're discounted and they seem quite cheap. That's because they probably sometimes don't add 2.5 mils, they probably add 3 or maybe 3.5 mils. So your 100 units is over diluted. The second thing is, how long has it been reconstituted with the saline? Because it loses its capacity, its potency after even a 24, 48 hour period. So you need to go to somewhere where they use this product pretty much all day, every day, and whatever's left over at the end of the day just gets discarded, so that you can be sure that every time you get your anti-wrinkle injection, it's going to work, and it's going to work for the full 4 months. As a consumer, I think if you're going to somebody that's reputable, experienced, preferably an accredited healthcare facility with the Australian Council of Healthcare Services or some similar sort of accreditation process, so you can have some confidence that that place has got protocols and standards that it must adhere to, because they're all set down by the accrediting body. We don't want to be going to hairdressers and doing these things, and even beauty salons. You need somewhere where you've got medical facilities, where it's infection control is really paramount, best practice, all those sorts of things. The other thing I worry about with anti-wrinkle injections that come in this vial is there's 100 units here. I'm not going to use 100 units on many people, if anybody. I might use it for abnormal sweating, 100 units. But that means I'm going to treat several patients with this one vial. It's only meant to be a single-use vial, not a multi-use vial. So it kind of worries me a lot that there could be a possibility of what we call double dipping. In other words, you draw up enough into the syringe and you inject it into the patient, and then you might not have enough, so you use the same syringe and you put it straight back in here with the patient's blood on it. So that's another reason why you need to be going to reputable people. There's quite a few things that you can actually do to source the right person. Number one, how much experience has that particular person had? That's going to tell you a fair bit. What else do they do? Do they do this as a part-time thing? Are they a GP that one day a month might do a few Botox injections or something like that? The associations and colleges. I'm the president of the Cosmetic Physicians College of Australasia, for instance. We've got over 300 fellows who are extremely well trained and experienced. So that's a very good qualification to look out for. See if you can find someone from the Cosmetic Physicians College of Australasia. That would be a good tip. And I hope you've enjoyed what we brought to you today. Check back on a weekly basis on our YouTube channel, and don't forget to subscribe. The link's down below.